Okay.
Oh, hello. Can you guys hear me?
I can hear you, Bill.
I don't think they can hear us.
Yeah, I can hear you too.
Can the council hear us?
I don't think so.
Wait, did I hear something? Oh, I hear more talking. I hear more voices.
Ah, there we go. Okay.
Yeah.
Well, welcome. Hey, everyone.
Yay!
We're
Hey,
back.
y'all.
They start to scream.
It's very sensitive, but we'll do our best. Yeah.
Can you get a little closer to a microphone or something? You seem a little far away.
Do you want me to run slides?
Yes.
Oh, yeah, that would be fantastic.
Okay, so we can.
Alyssa. Is that better? Can you guys hear us now?
That's
Yes,
better.
that's better. Thank you.
A loud
Right.
voice, Gabby. You gotta speak up.
Here, it's perfect. I will speak up. Great, so we're on that slide. So basically what you guys missed was really just like the intro of the
progress to date. And we really kind of just highlighted that you guys are on standby, to really just help answer questions if any come up. And council members will kind of raise their hand if anything comes up as Lizzie and I are going through the data.
Thanks, Gabby. Are you presenting the slides? Because we can't see them.
Oh, yeah. I'm not sure.
We're gonna get it together, y'all. We're gonna get it.
You know, it's a work in, it's a shared progress. It's shared.
It
We
is.
got this. We got this.
We do.
Boy, Bill, you want a lot, don't you?
How many RUO act does it take?
All right, so I will add a few thoughts. So the data that we are able to share today. Oh, wow, our notes are very small. I will do my best. I wanted to preface this by saying we're responding to the Early Learning Council's request for data related to progress related to Raise Up Oregon. And the data that we're going to share today, the agencies, as our partner agencies in Raise Up Oregon, worked to select the data that related to some of their updates that they wanted to share and their policy priorities. And these data were collected based on the following criteria. So they're related to agencies, policy, priorities, and strategies. They're readily available for our discussion today. That was very important. And we wanted to be able to have data points at multiple time points so we could look at change over time, over the life of Raise Up Oregon, including Raise Up Oregon 1.0. And then a few notes about our data that we're going to share today. The first one is love the data you have. We made sure to work with agencies to find data that was readily available, which means for the most cases, things that agencies are already published or already collecting, and for the most part, already publishing. As such, we're relying very heavily on administrative data, and there are limitations to what we can learn from administrative data. The first limitation that you're going to be aware of pretty early is there's a time lag. The most recent data point for some of these you're going to see is 2023, because it's still 2024, which means there's still data that we're gathering from all of these programs. And in some cases, we're going to see 2022. And that's kind of the limitation that's baked into administrative data. Additionally, administrative data is really pulled away from root causes and root experiences from families and children within our system. And that might feel potentially a little stale or a little dissatisfying when we know and we've heard today from many folks who are embedded on the ground within the system. There's no clear causality. We're going to be able to talk about some of the policy efforts that have happened, and there's not a direct line between the work that the agencies are doing and these data, but we're going to do our best to fill in the context and help us understand what goes on behind the data. And lastly, we're looking at state system level data. So we're really pulled back today. We're looking at the early learning system at our state level data, which means that we're going to lose some of the wonderful variability that exists within our state. We're not having an opportunity to look at regional differences, for example. So just helping us set the stage, we're pulled up, we're bird's eye view, eagle eye view of our system with the data that we're sharing today. All right. So we're first going to start with some quick snapshots and setting the stage for our state with data. So first, each of these squares is a topic that's related to the work of one of our partner agencies. First, about a third of the children under the age of 6 in Oregon live in low-income households. And low income, for the sake of defining that today, is 200% or less of the federal poverty level. At the same time, it costs $9,000 to $18,000 a year to send a toddler to childcare. And we know that infant childcare is something that's going to cost more. Pre-K childcare is something that's going to cost a little bit less. But most of the burden falls on families, many of our families in Oregon. thinking about our lowest income families with children under the age of 5, these families are spending nearly 90% of their income on rent. If we think about all of the families in Oregon with children under the age of 5, we see something more reasonable, about 1/3, 33%. Those of you who rent might know that that's like a decent figure. They will rent to you if you make more 3 times the rent. But when we look at folks that are very low income, 30% of the median family income or lower, they're spending nearly 90% of any income they receive on rent. A little bit of an upside, 95% of children under the age of 6 have health insurance. So they have at least access to the ability to receive health care. The median ECE workforce wage is about $16 to $22 an hour. So thinking about how much it costs to send a toddler to childcare and how much ECE workers make, it's not really a happy side on either end of the participating spectrum. And lastly, when we think about when kids enter kindergarten, 45% of kindergartners are chronically absent, which means that they are missing, they are attending 90% or fewer of the days that they are enrolled in school. So that is the context, very quickly, very high level of what we in Oregon are facing.
I'm sorry, the 45% absenteeism, is that also 30% AMI group?
I'm sorry,
So area meaning, that's
area meaning, oh, right.
same level of income for each of these boxes?
No,
Yeah. Okay.
so we're kind of like, we're hopping around. So the 45% is for all of the state.
For all of the
income.
state.
Yes,
No kidding.
yeah. Now, chronic absenteeism is they're attending 90% or less of their days. So they're not considered regular attenders, but yes, nearly half.
Does that, I'm just saying, I have a 3-year-old at home, and so my first thought is, yeah. Because even at the preschool level, my daughter's home usually 1 week out of the month out of just straight illness because of their age group. So when they get into 1st and 2nd grade, does that absenteeism continue?
That is
Or is that, I'm wondering if that's an age specific because there's a lot of germs happening and kids are being home, or if that's something more that's a trend.
we don't have any sense of the why in this data. I would be able to look though at 2nd and 3rd to see what the pattern is. I know that kindergarten absenteeism is generally more of a challenge than in other grades, but I don't have the data off the top of my head, but I know where to look. So I'll make note of that. I'll pass it to Gabby.
Great, yeah, and we'll head into just highlighting some of the progress in the phase 1. And then we'll get to the next slide also, just I'll catch up on time a little bit. That first slide really kind of just highlights some of the things that you'll see in this slide here. And really kind of just highlighting that in regards to goal 1 with government to government relationships, you'll see some progress from DELC and ODE. With both of these agencies releasing non-competitive funding opportunities for birth through 5 literacy for tribes. And this was separate, so it's 2 different funding opportunities. With multi-agency partnerships, OHA is continuing to collaborate with communities and agency partners on the implementation of the 1115 waivers. OHA is also working on just building internal capacity to really monitor the waiver services for children and families. ODHS's refugee program and DELC partnered for a series of immigrant and refugee early learning resource fairs to provide education on early learning programs for children and early learning workforce opportunities. With housing, they initiated the co-location of affordable rental housing with early learning and education programs. And with objective 3, the early learning hubs, which is also one of the council's priorities for this last year. We've been seeing a lot of progress with this objective, most notably the council DELC build and hub work group that we've been engaging with over the last couple of months. And lastly, the Center for Coordinated Oregon Home Visiting Systems was established this year, and that the COVES is being funded by DELC, OHA, and philanthropic partners. I know this is a lot of information, so I'm just noting some things, but you guys do all have information that just provides like one notes for that.
So for our first data point related to services that we are going to share, this is something that many of the members of our RUO Act wanted to highlight because home visiting is a place where there's lots of work being done from all of our agency partners. It's a place where there's multi-agency partnerships and coordination really at the forefront. OHA, DELC, ODE, and ODHS all offer home visiting programs. And we wanted to take a look at 2019, which is data that was pulled from the maternal and infant and early childhood home visiting needs assessment. And that was a contracted piece of work with our partners at Portland State University. Did I say our partners? It was OHA contracting with them for this. And it was a big effort. It took a lot of effort to gather all of that data. And now with COVES, the Center for Coordinating Oregon Home Visiting Systems, we're in a position to be able to do that, not just as a one-time project fund, but have this data on an ongoing basis, which is very exciting. So I worked with our partners at COVES to gather a second data point. So for 2022, across all of these programs, across multiple agencies, specifically for preparation for this meeting. And we can see that the number of children or families who are served by our various home visiting systems has increased between 2019 and 2022. Let me take a look at my notes. So I'm aware that Dr. Green from COVES presented about the founding of COVES. So you might recall that building out the data systems is one of the goals. And what's particularly exciting is that we're currently looking only at state home visiting services. And Beth and her team has an interest in seeing, well, what are we missing if we only look at state funded and state coordinated home visiting? Are we missing regional home visiting? Are we missing community-based organizations, home visiting programs? So there's an interest in not only getting this data more frequently and systematically gathered for states, but also trying to expand our understanding of home visiting to include regional programs as well. So while there is an increase of the number of children and families being served by home visiting programs, we're serving about the same percent of the eligible population. And I put quotes around eligible because this is particularly challenging to think about, because all of these different home visiting programs that we have, they serve different populations. They think about eligibility in different ways. Some take a more universal approach. Some focus on a specific need that the family has. So this estimation, please hold a grain of salt in your mind as you hear it. But if we take a rather liberal estimation, which is the number of children under 6 in poverty, we are serving exactly the same percentage, even though there has been an increase across this time. So this is an opportunity to focus on cross-agency partnerships as well as philanthropic partnerships and how we're building out systems to learn more and understand more and communicate better about our partners.
Next slide. And then this slide here, we really just wanted to highlight some of the council's priorities that fell under the first goal of Raise Up Oregon. And it kind of highlights just some of the activities that the council did in respect to the early learning hubs and home visiting. So really kind of just want to call out again that there's been a lot of progress in regards to the hubs and really identifying some of the core roles And the council is really just ensuring that progress and momentum is really still going with the hubs and their work. With home visiting, again, the Center for Coordinated Home Visiting Systems was launched. And then there's also a home visiting system funding advocacy work group that's forming as a subgroup for the Early Childhood Coalition that's administered by CI.
That's the Children's Institute.
Okay. So that's goal one in a nutshell. There was a lot more, by the way. I just want to say that the agencies put into this quite elaborate tracker we made. Okay, but since we're in discussion mode, 100% of it is not included. But let's open it up because people may still have questions about things you've heard that you've clarified. But we're also really interested in hearing from everyone, you know, what stood out to you as you got this update on 2024 activities, things that we're happy to hear, things that might actually be real concerns for you. And as we talked about, as we're continuing, the state team is continuing to build its infrastructure and capacity to document and share back to you. Basically, if there are other things, basically, and information you would like to see, and that's because the RUO is all here, at least they're on screen in the virtual space with everyone here together. So then we are welcome to.
I always go first, and I don't know if someone else wants to go first. Okay, I'll stay zoomed out, cause I have like nitpicky, like little things that I'll just like talk to you later or something, okay?
You can send an email, you can grab us,
Yeah.
however is best for you.
So
We appreciate that.
I was, first, let me start with, I am in great appreciation of what a big endeavor it is to try and track all of these different objectives and each bullet point, 3.2.1, 3.2.2, there's like a million things you could look at, and it's very complex. So I want to start with that appreciation. I want to go back to actually slide 6, where, you know, you had the state and you had like those facts. I feel like there's two things that I think this data narrative does for us. One is for us as a council and for people, state agencies, all the different agencies, it gives us a sense of where are we? Like, where are we on our plan? What's going well? Where do we see significant growth and progress? Where are there issues, right? But then the other one is more of an advocacy tool of like, this is the problem that we set out to address. This is why we are doing all of this stuff. And here's where we're at. And we want to impress you a little bit, right? So I want to be very careful about what we are saying is the problem statement, right? Because this slide reads to me as a problem statement, right? It's like, we're saying these are the issues, and these aren't necessarily the data points I would choose to say, like, these are the problems that I think I think we could come up with a pretty good list of what we think are the problems. So I wanted to say that. And I think as far as setting the stage goes, we do need something that really functions like a car dashboard. That's like, here's the state of where we are on all the objectives. Here's like 2 or 3 key metrics, key indicators that show objective 1, here's where we're at. Objective 2, here's where we're at. Something that says green, yellow, red, we're good, right? Or whatever, right? It might all be fiery red. I hope not. Okay.
So can I ask a clarifying question right now? Because one way to think about what you're saying for purposes, because this is in part readiness, right, for public report, et cetera, is we could track how the staff rate the health, basically, as it were, of an objective, right? You know, and so that could be whether people think the work they committed to is happening at the pace, right? You know, and whether the timelines, people, that's one way to do it. So I wanted to test that back because although I don't want to speak for the state team, but the state team has identified the data they've been able to identify so far.
Yeah.
And so I want to maybe clarify, hopefully giving them a sigh of relief, that you're not asking that there be a data indicator for every single objective.
No. I think, but I guess where my comment is really leading is this is gonna tell a story.
Yes,
And we want to
yes.
be very like intentional about where we're saying we're at and things like that. So no, I'm not suggesting that we take each indicator and come up with some sort of data metric infographic for each. That would be an impossible task and not worth it. But yeah, just I would say the grain size should probably go towards like the strategies, right? Like there's 16 strategies, right? Something at that grain level that says within this strategy, we can kind of sort of indicate the health of how we're going in that particular strategy with this indicator, something like that. Yeah. And then I'll just say this one last thing. I have other things, but I totally get that the task and where we're at right now is like, we're just identifying what we've got, right? And we're like making a list, right? Totally get that. I would love to get to a point where whatever can be counted, right? If there are things, that numbers that are meaningful, that we count them, right? And so like one example, for example, was like early learning hubs. Under early learning hubs, it's about like how many times we're engaging with them, right? Like I think that's a number that we can show like in the future, I think I love I love that we're also including qualitative descriptions of how we're making. I don't want to lose that. I'm not suggesting let's all go quantitative, but what can be counted, I would try to do it.
Okay, that was a great start to our people weighing in and chiming in. Other comments, thoughts, questions? Peter?
I was very happy to see that we're starting to get a baseline on visiting, and I'm very grateful to hear that we're going to expand that baseline to include the regional programs too. That's the right course that we're in. And then in terms of the goal of, relationship with the hubs, this is probably not the right time, but I'll mention it anyway. I really do hope that we move forward to having the hub representative join the Early Learning Council. I mean, as a non-voting member, but that we have a hub representative at every Early Learning Council meeting that access to the hubs information for us.
I love having data for us to look at, similar to, I think, what I heard Subin saying, maybe building off of that is what data are we starting with? And I understand why these were chosen. But if we looked at Raise Up Oregon and said, like, what's our goal for the data that we want? That would be useful, not just to Delk, but also useful to the other agencies. And I know the other agencies' data is represented here, but are those the things that when they look at Raise Up Oregon and let's say OHA's part of Raise Up Oregon, are those the meaningful data points for birth to 5 that they're tracking on? And just sort of like getting people because this is the only place that we're in the state all looking at birth to 5 data. So it's such a rich opportunity to sort of find these data points that are the most critical. Because then if we have meaningful data that we utilize to sort of choose the priorities, then I feel really data informed and then I can really start to dig in on measure. So that feels very like a really right opportunity for us, and I'll pause because I know others have lots to say.
Robin, though, let me just say that how the data indicator that Lizzie talked about on behalf of the whole team came to be was that all the people in the virtual world, plus the few of them here, actually met together and basically went through the plan. Lizzie did do some preliminary identification because we did have to set as data people could produce, right? This wasn't back to what do we theoretically want. This was like in the real world with the data you have, what is the data that would be meaningful? So the data here is really from the agencies, okay, and it's from the recommendation basically and the vetting. There was I participated in some of the conversation, not 100% of it, but I will say there was rather rich discussion amongst all the people around getting into the data. I think you've heard your point, which is, and I think if people want to speak to that, there may be some gap between if you asked an agency director or if you asked the state agency reps who support Raise Up Oregon, what did they think was most important? They might not have been able to offer a data point that went with what was most important, okay? But people did the best they could within the accessible data. So I don't know, Kate, I'm kind of looking at you or Bill. I don't know if any of you want to say anything now about that, or if we want to keep going, but your call if you want to give any other commentary.
Go ahead, Bill.
Dang, Kate. I know. No, I think it's a good, actually a good question. It's a good call out, to be really candid with you. As folks know, I mean, the work out of ODHS, it's really a whole family, and we work with the family system. And so the data that we gather is really around family systems and the support that we provide. And so when we're looking at certain data points specifically for young children, it's really looking at that family system in which that young children is thriving and kind of residing. So that's kind of how we've been couching some of that data. So in a way, it's extracting key data points of that young child in the family system. That being said, I think this is also a transformation and evolution, I would say, from Raise Up Oregon 1 to Raise Up Oregon 2. The original one was very much focused exclusively, and I would say exclusively, but it was leaning more so on the child development and milestones specific for children. There's definitely been a level of intentionality and deliberate effort to look at families as a whole system, and how to really have families thrive and really having that young child thrive. And what does that look like? And that's where we come into issues around housing, food insecurity, domestic violence, substance use, and so on. That really, how do you foster stability and well-being for that family system, again, for that child to survive? So when we are talking about some of the data points, I think it's a good question to ask. That is one thread of our data, but it doesn't speak to all of our data. So I think that's how we've been trying to unpack it, but also, I think we can't do it in isolation. So the work that we do, we need actually partners over at DELC, and we need our partners over HCS. So as we are looking at family systems, everything we're talking about in our shared data is looking more holistically, right? And I think that's kind of where I see the opportunity. And to be kind of candid with you, I think that's also one of the things that I've really becoming quite taken by, even the RUO group, and actually things that are coming out of this conversation. So I'll stop
Thanks,
there.
Tom.
No worries. Good, Kate.
Oh, I would just echo what you have said, and this is also the first take on how we're sharing this and looking at this data too. But elevating those pieces of work that really are cross-sector that we all are needing to focus on together, because it's going to take all of us to look to make some real impact. I think that's really where we're focusing a lot on. So I think you'll see that in what got elevated. There's a lot in there, and you can dive into it and for some late night reading for sure. But we can't share all of it all the time. But if there are pieces that seem to be more that would resonate more with y'all, let us know, and see what we can do.
Thank you, Kate. Let me just respond really quickly, is we heard a presentation earlier today where they were showing the data that was related to the health complexity data, and those were like very tangible moments where you can put a child in the center of the room and say, okay, entered foster care into parent has substance use. And that's that cross-sector data that I think where we can take a child and put them through all these system pieces and make it really relevant. And so I love that we have data. Thank you so much for letting me ask those questions. I won't take more time.
And that's great. Thank you, Robin. That was really stimulating. Are we okay to move on to goal 2? Because we have lots more to share.
Okay, I have a quick question. I'm getting the impression that what we are seeing here on goal 1 is the tip of an iceberg, and there's lots more data that you have, Lizzie, that we just aren't seeing. Where would we find that for bedtime reading?
Oh. Well, I think that there's more in the presentation. First of all, we can start with what's there. There are some resources that are not necessarily up to date. There is a Raise Up Oregon data dashboard that was put together primarily through Raise Up Oregon 1.0 that has a number of these. And also some of the agencies looked at what we had and said, actually, there's something that's better and more aligned. So some of these are not currently in that dashboard, and I'm making lots of notes about how we might be able to shift that data tool to meet more of what I'm hearing from you all today. And then there's many reports that I could send, and I'm not sure which ones would be sort of the right ones. But maybe we can connect.
Sue started it, so.
Yeah.
I would say, you know, like, I'm not imagining like a conventional report with citations, like most people can just glare and just fall asleep reading that. But I am imagining something really dynamic where it says like, for this data point, for more, click this, go to this, read
Yes.
that, right?
Yeah.
And so I think that is the kind of thing where, you know, for example, as I focus on social suspension and expulsion prevention, I'd love to find the data sources and read more on a particular thing when I'm trying to look at that thing.
Yeah.
So just making sure that the council has access to the original data, I think is important.
Great.
Okay, that's
Thanks.
wonderful too. So I think we have a lot of good ideas, basically for continuing to improve. But there'll probably be more as we get into goal 2.
Yeah, so just keeping things moving along, with goal 2, let's focus on family support. Just highlighting some of the progress that you'll see in these next couple slides. You'll see that in this goal, there's progress specifically towards expanding family access to health services, increasing parent and family education resources, increasing affordable housing efforts, and expanding family preservation sites. And so, again, a lot of info I'm just gonna highlight too, because we do have 2 slides of this, so it kind of just ends up being quite a bit of information as we go through. The objective 5, really looking at family service access, you'll see that ODE facilitated a Medicaid work group to support EI, ECSC family access to Medicaid. OHA also did some work as part of the 1115 waiver with climate benefits launching this year. As you all know, I think climate supports is a health-related social needs service. And the 1115 waiver allowed OHP to provide air conditioners, heaters, air filters, mini fridges, and portable power supplies to really help keep people safe during climate events. And just noting that 50% of the supplies were delivered to individuals under 18. Another part of the waiver is OHA working with housing to launch the housing benefits outlined in the waiver. With regards to economic supports, ODHS implemented the ending of full family sanctions for TANF. And ODHS also received funding for food programs for families like the summer EBT program and the child and adult food care program through the legislative session this year. And ODHS is helping support the implementation of the state earned income tax credit. With objective 7, family access to health services, again, lots of good stuff. Noting that OHA created a family care plan for substance exposed infants, and they also help train public health nurse home visiting programs for referral and case management, and assisted local Oregon mothers care sites with outreach and prenatal navigation. Okay, so a little slow. With objective 8 in family preservation, really want to highlight the expansion of the number of family preservation sites going from 3 to 8. Housing is also doing a lot of great work in redesigning their funding process to create a framework that's based on project readiness. Housing is also working on updating its qualified allocation plan, or QAP, to ensure that it aligns with the new Oregon centralized application, which is also known as a WRCA. And then with regard to objective 10, parent and family supports, DELC was able to distribute fundings to the early learning hubs through the Birth through 5 Literacy Initiative to support parenting education and professional development. And ODHS developed training and coaching modules to enhance community visiting practices and engagement. And then OHA's maternal, infant, and early childhood home visiting program also provided scholarships to OPEC for the Oregon home visiting workforce and scholarships for home visitors, in addition to helping folks participate in the Latino Health Conference, which focused on maternal health this year.
So lots of updates. Great. All right, so here are some more data points. The first that we're going to talk about is postpartum care, and that data is going to be connected to Raise Up Orphan Objective 7, which is family access to health services. From 2019 to 2023, the percentage of women receiving a postpartum visit, which is a postpartum visit on or between 7 and 84 days after delivery. They received a postpartum visit. That percentage increased by 15% from 2019 to 2023. And then this is not a population level metric. This is for yes, so those enrolled in coordinated care organizations for at least 12 months. And I'm going to allow Kate or others from OHA to pop in with more context if they would like, or to address any questions that might that folks might have about the data.
I don't know if there's more context to put, but this is a nice trend. And with the advent of the postpartum expansion of postpartum coverage to up to 365 days postpartum, we're hoping to see this actually increase more in the next year or two. Also, just think about this, that these increases were happening during a pandemic. And so that's pretty impressive that this could continue to grow and grow. Because that postpartum visit and that care is pretty important. It's a recommendation of the Maternal Mortality Review Committee to increase those touch points for postpartum people. Just some more context. So happy to answer questions if I have the answers. So.
Is this a postpartum visit by any entity or specific entities? Is this state funded visits or is this all visits?
These I believe are specific postpartum care visits, very specific, after you've delivered. Are you asking about the expansion of the postpartum coverage?
I guess I'm just asking who's doing the visits? Are these?
Medicaid.
Oh,
Yeah.
these would be like OBGYNs or the clinical providers. And again, this is what's coming out of the CCO data, claims data.
Fantastic, thank you.
So they wouldn't, Kate, this is Sue, so they wouldn't be home visitors or doulas, they'd be medical professionals.
Typically, right. That's what this postpartum visit is looking at. It's a typical part of standard of care. And I forget what you said there, Lizzie, about the range, but it's typically 6 weeks postpartum. And it's just to make sure everything is okay with the birthing parent or the birthing person. And part of the university offered home visiting is to ensure that that birthing parent does get in for that postpartum visit, along with ensuring that the infant is getting in for their pediatric visits. So that connection back to the medical home and healthcare.
Awesome, thanks.
Kate, do you want to say anything more about the connection of this indicator to all the focus on basically maternal mortality and good maternal health? Why this one has risen so high in terms of people's considerations?
Yeah, so it's very heartening that that maternal health is really getting so much spotlight both at the federal level, and it's trickling down in a great way here, and to the states as well. So and a lot of that has to do with leadership at the federal level with their Momnibus, which is looking specifically at Black maternal health, but also the elevation of maternal mortality review committees. CDC has really done a lot of investment throughout the country. And in fact, we just received a 5-year grant from CDC to almost $500,000 per year to expand how we do our maternal mortality reviews, to include interviews with the families and friends who knew the person who passed, to do more just robust analysis and trying to then continue the outreach back to communities and share the data and then be able to support communities in prevention that works for their community. So there is a lot that's happening and there's a lot of grants that are coming down from the federal level. Most of them are small grants, which sometimes you have to balance. Is it worth was my friend say, if the juice is worth the squeeze kind of thing. But this is really, I think we've got a nice community of partners who work in this space, who are very interested at the community level. And then, of course, this feeds right into the Momnibus that Representative Reynolds is doing, which is a little different from the federal one. But and I think you've talked about that, or many of you know about that. So,
Thank you, Kate. All right. So now we'll move to an indicator from ODHS. And the indicator that we're looking at today is the number of young children served and being actively served in foster care settings. And this data point is related to Raise Up Oregon Objective 8, which is that families have access to family preservation strategies, resources, and programs focused on the prenatal to 5 population. And as you can see, there is a distinct decrease from 2019 to the most recently available data point, which is 2022. So the number of children 0 to 5, there's been a 29% decrease across this time. And this decrease is indicative of ODHS's implementation of a family preservation approach, which aims to serve families and children in their homes and communities rather than in foster care. So Bill, I don't know if you want to provide any additional details and context around this data point.
Actually, Catherine, I'm going to see if Catherine wants to get your voice in here too as well from Child Welfare Partner.
Sure. These data points really reflect the work we're doing with Family First and family preservation. The other thing that folks might need to know about context of the data is in 2019, we went from regional child abuse hotlines to a statewide hotline. And part of that was so that we were reviewing cases consistently across the state. And when a child abuse report came in, what was assigned in Portland was the same as what's assigned in Medford or Ontario. And our child abuse hotline has done a lot of work and had a lot of review around that implementation. And in 2022, they went to a structured decision-making model to even be more consistent with an eye on equity issues and all of that. So I think there's a lot of reasons why our numbers are going down, but serving families in home with supportive services is really the goal moving forward.
The one thing I would add to that, if I can, I think you alluded to it, was family preservation has been really effective, and we're really found very promising results of it. One of the key things I think that might be of interest to the council is I was asking the manager overseeing the project just for some data, and they were really kind of said the majority of the children being served in family preservation actually are 0 through 5, and so that is a large population being served in some of these proactive prevention-based strategies to reduce the number of kids that are going in. So how are we providing the supports for that family system, concrete economic supports, what's going to be necessary to stabilize in a way of reducing any child welfare involvement or out-of-home placement. So as family preservation has been moving from 3 sites to 8 sites, and the next phase is going to be moving out to additional sites in the coming year, we're really optimistic and really excited by what the results are showing us at this point.
So, Bill, this is Sue. A follow-up to that. Do you know what services Family Pres is funding or providing that is making that difference of allowing kids to stay home safely?
A lot has to do with the strategy of it's a combination between child welfare and self-sufficiency. And it's moving away from the where of a child welfare is kind of that surveillance model into self-sufficiency, which is really providing what are those supports necessary to stabilize. And it's really building on the family coaching that we've been doing in self-sufficiency for a number of years. And then how do you really engage the family, starting to address some of the social determinants and some of the other barriers that are actually maybe triggering and some of these stressors that they're having that are leading to reports into child welfare or possible out-of-home placement. So without question, one of the key drivers has been this partnership between self-sufficiency and child welfare, and really looking at it in a much more integrated way. So there's not that clear delineation between, child welfare, therefore you're going to safety, out-of-home placement, but we're really trying to get that earlier support for families before there is that level of acuity or the need for out-of-home placement. This is the first phase of it too. Ideally, it's really looking at down the road, how we're able to really promote stability and well-being even further upstream. So we're not even having some folks are going to be referred into, for instance, a hotline or other areas like that as well. So yeah, so this is a model that has been really effective. But I would say if you're answer your question, Sue, I think the partnership between self-sufficiency has been really one of the key drivers of that.
That is really exciting though.
All right, so one last data point for this second goal of Raise Up Oregon. So this data point is connected to Raise Up Oregon Objective 9, which is related to affordable housing. So Oregon Community Services provides subsidized money for new developments. And right here, we're looking at, oh, I'm sorry, Maria.
Just a quick question on the family preservation sites. You said you went from 3 in total. Are you looking to continue to go, like, at what point would you be at, we've reached our, what we're gonna have statewide, we're at max capacity, we're serving all the families, like, what's your top number?
Of the top number of sites we're going to have in the next phase. The next phase sites, I'm not positive on the next phase of sites. It is going to go statewide without question. It's going statewide. I think they did 3 sites. They've gotten a lot of the input that from those 3 sites from last year. They moved to 8 sites this year. In that first wave, that first cohort, those 3 sites, they did some district-wide work, and then they did some local office. So for instance, in Multnomah County, instead of doing all of Multnomah County, they did one branch in Multnomah County that had a very high caseload and high number of families that were involved, and they use that as an example. But now what we're finding, even like you're doing things in Multnomah County at that one branch, the practice and the process is starting to generalize out, even out of that just one branch. It's moving forward. So eventually it is going to be statewide. The timing on that one, I apologize. I can get back to you on the exact timing. I can find that out because I don't want to give you a date that's not going to be on the mark.
Thank you.
You're very welcome.
Thanks, Phil.
Just wait for the ready. There's 5 minutes.
Good. So we're gonna hop into housing again. So what we're looking at is the percentage of subsidized family size units. So family size, we're saying is 2 bedrooms or larger for the sake of this data. And the percentage of those being developed and funded through subsidized funds has increased from 11% from 2019 to 2024. I lied, we have a 2024 data point. And I want to open it up to Chelsea, I believe.
Yeah.
Any additional questions?
Yeah, I appreciate that, Lizzie. Thanks, y'all. It's good to see you. It looks beautiful down there. So good to see you. Just maybe a little bit of context about this, because I oftentimes I think about affordable housing as both the sticks and bricks development of a building or a unit, or it could also include preserving units that are already naturally affordable housing. This data point kind of fits squarely in the sticks and bricks side of our work. I think that there is likely, and Lizzie, you correct me if I'm wrong about this, but I think there's also some data around things like housing cost burden energy burden, which doesn't necessarily fit squarely in our development side of the house, but I think is also an important indicator to be tracking, knowing, how spending on rent and energy services or housing costs generally. So I think, if there are questions about more of that deepened data, and I think I'm just kind of reflecting on our earlier conversation around telling the story and how are we dynamic in doing that. I think there's absolutely opportunity for us to get a little bit more focused on some of those other data points. This is a really cool data point for us. I think particularly over the last 5 years, we have been working on our own statewide housing plan, which has several different priorities, one of which is increasing the number of units of affordable housing that we're able to put on the ground. We had a 5-year goal of around 25,000 units, which we surpassed, which is awesome. There was quite an uptick between 23 and 24. A lot of that has to do with what I think we talked about earlier. We have been really interested in reimagining our funding processes that hold the resources to do sticks and bricks development. So figuring out ways to ensure that different funding mechanisms can be leveraged or built upon each other, making it easier for folks to come into the development pipeline who are really interested in putting units on the ground, right, that are in alignment with our values. But that has also included thinking about what we are incentivizing. And over the years, and really, I think as a result of our partnership with DELC, with ODHS, OHA, all the folks on the Raise Up Oregon team, we've been thinking more about how we incentivize family size units. We had a specific pot of funding that launched, I believe it was around 2015, 2016, called the Local Innovation and Fast Track Program, which had a specific call out, an incentive call out for family size units. So when we say family size units, we're talking 2-bedroom and above units. And so that incentive could look like more subsidy per unit for a developer to receive to build a larger unit. Larger units typically cost more money to build. And so we need to be accounting for those increased development costs and ensuring that people want and can build larger size units. I think what is not couched here is we will see, we anticipate that there will be more family size units that are co-located with early childhood education centers as our co-location program continues to grow. We are in the very early stages of that co-location program launching. So we anticipate that there will likely be some additional units that will come online. But all of that to say, I think as we continue to get more nuanced in how we put resources out for availability, resources that can incentivize things like family size units, which we know that families with young children will absolutely be living in, that will likely continue to see an uptick in the number of units that are able to serve families. And I'll maybe one last note here. When we say subsidized housing, essentially we are talking about are there government subsidies or resources that are either in the development itself, the building itself, or are there units available where a family might come with a unit? So I think come with a subsidy, right? So I'm thinking about like tenant-based Section 8 vouchers. Are there enough units available? And sometimes that can be tricky to track because for project-based vouchers, families and oftentimes are looking for those units. We're not necessarily tracking. Those might be market rate units that a landlord has also said that we're going to take a voucher. We don't know the ether of all of those. And so this is probably these numbers I think are really focused on the resources that we have in buildings in real time around the state. So this is great. I think we continue to see more and more units. And I think we are really, really continuing to be interested in building larger units, knowing that we're able to serve more folks that way.
Coming back to just some of the council contributions, and activities that you all have done over the course of the year regarding these two priorities. Want to note that the council again did invite agency partners to a council meeting earlier this year, to really just provide an overview on the need for affordable housing. Chair Miller also joined the Housing and Stability Committee to talk about Raise Oregon and bring awareness to some of the cross-system work that's happening. So with that, right, the ELC continues to really champion for strategies related to housing. And you guys are really bringing, helping bring focus and attention on the need to affordable housing and the efforts that communities are making to support that. With family well-being earlier, during the legislative session, the council submitted, a letter of support, to, the Senate President and, House Speaker, in addition to the House Early Childhood Human Services Committee and Senate Ed, relating to, supporting additional funding for ODHS, the Child and Adult Food Care Program, and for the summer electronic benefit. And the legislature did end up approving this funding. There was also more things noted within this letter that we'll get to in goal 3 as well, that has some outcomes to highlight.
What could be interesting with regard to this this section is, as the co-locating of childcare centers and affordable housing come online, begin tracking that, and also track the challenges I would imagine when finding providers to actually provide the services in those places, given the shortage of providers, the stresses on nonprofit organizations doing the work all across the state.
That was totally where my brain was like, when we get like a new revision, like the next iteration of this, like, I don't want to sweep those things under the rug, right? Like whatever the challenges are, it should be very plain to us that these are challenges. And so, and I just want to face those realities. So, and then the other thing that I was just thinking about is, you know, thinking about future iterations already. And I don't want that to take away from appreciation of what it took to get to this place. I would love to just see the exactly how it's laid out in the plan, 9.1.1. Actions taken in this space, right? Here are the actions that have been done. And we might learn that some of the things we're not doing enough. The challenge of that is like, when was that last updated? To your point, Lizzie, like when was that last checkpoint where we could, because it's not going to be like hitting a refresh button and everything gets refreshed, right? So I totally get that challenge, but yeah.
So Susan, for the publication, so we have clarity, this represents information on the narrative, the qualitative data side of this, let's call it that was put in from the beginning of 2024 through early September, okay, mid-September. The public final version will sweep through the end of the calendar year. So that is the commitment of not what happened in 2023, but what's the work, so that you all can see that the agency staff are doing basically, and the contributions that they're making. So I just wanted to share to have that. I also did want to say, because I can see people are starting to get a little tired. So I don't know that I mentioned when our break is going to be. So after we do goal 3, okay, so we have the one remaining, then we're going to have a short break. So I know that people get inside, so minutes you will be able to take a walk outside or do what you need to do. But we are going to take a pause after we go through goal 3 before we come back to it together.
So can I just add, the whole goal around co-locating childcare with especially multi-family, multi-room units. Whenever that data set starts to populate, it would be really great to understand how much it relates to the amount of families are occupying those spaces, and how many slots, I guess, are being offered as well in co-located spaces. I don't know what that incentive program looks like. I just can't remember what it was, what the details were, but it'd be great to track whether or not that's actually working for all the reasons you mentioned, you know, there's the labor out there, but just the challenge of the economics of it as well. Thanks.
Well, that brings up a question for, does it matter to us how much we're spending in each of these like, is that something we want to be visible in something like this, or is that just, we just know how much we're spending in each of these areas?
You mean the budget for each of the
Yeah,
areas?
yeah.
I think it would be useful to know what these things are doing.
I don't know, but it's,
That seems like the ultimate accountability measure, right?
Yeah.
When we go
Yeah.
back and ask for more money. We need
Yeah.
to know how it's being spent,
Right.
where.
right, and there could be a rationale, like, you could say, like, even if the ROI isn't particularly high in a specific area, we could say, oh, this was an innovation, we're trying, we're, you know.
Of course, yeah, I mean,
Yeah.
that's exactly right.
Yeah.
We just need to, I think being able to cogently describe the reason why is useful. No, I don't think it necessarily undermines the value of it if it's not a high ratio.
Yeah.
One of the things to explore with you is how to, the time it takes to share the funding and then the impact it has. So we know some children's cabinets around the country have done a lot on children's budgets that haven't actually resulted in more funding. And I think, I don't know, Harry, if you agree, one of the hard things to do is numbers can look very big, but not actually be big. And so I think the comparison of how to do comparison, but then not pit early childhood.
Absolutely.
Right, against K-12 or pit early childhood against mental health funding or that kind of thing, but also set dollars, because for some people, $20,000 is a lot. For some people, 500,000 is nothing, right? Like, right, so it's, I think we haven't always found a way to do comprehensive. I think it works better when you're trying to go for something that you have comparisons or why you want to serve. So it's just something to explore because there's a lot of smart brains around this table of the effort to collect the funding. How does it help you all first as a council? And then as your advocacy or champion role, how to think together, because I think I've seen more barriers than successes and kind of broad funding reports.
Yeah, I mean, it's stimulating my thinking, because, for example, in areas perhaps just from this round that have been council priorities, right? We could seek to try to include in the report, this is the idea, let's start with what is attainable, maybe take areas that have been of high interest and be able to do some of the budget highlights alongside the progress reporting.
Yeah.
I think because you've made the point, right? At some level, the resource and the accountability for the investment that does matter in the public discourse, right? And these documents have been, since their inception, pretty free, basically, of the budget pieces. So there are things I think to talk about, basically with the staff in terms of how some of this might be able to be worked out, possibly even for this first public reporting.
It just seems like we don't understand how much
Yeah.
money it takes. That's a question we always ask, right?
Yeah.
What will it take?
Yeah.
I can't imagine the average person out there can even understand the scale of what we're talking about here either, right? So even having a number attached to something.
Yeah.
Would be helpful, I think, for people to understand. The lay person will not. Maybe they need some more explanation, but we need to see a number. Like, we don't know what we're working with until we have some kind of figures attached to it. I want to make one more comment, and I appreciate that some of this is disaggregated by race. And I would just be really interested in digging into those things a little bit more, where some groups have done a little bit better and some haven't, or have done worse. And just trying to understand what those strategies sort of look like, where they've been tested, with what populations. And I know that's kind of digging into the weeds, but I think it's an important piece that we haven't really talked about yet today. Because I'm thinking about the growing diversity of the state. And we're not prepared to address that growing diversity of the state, especially as I think about economics and workforce and what does the future hold. I'm very worried about what that looks like, so would love to know more about what those specific efforts look like too.
Okay, let's go on to goal 3, last one.
Yeah, goal 3, you can go ahead and go to the next one, Harriet. Again, just highlighting some of the progress you'll see in the next few slides. Your progress in enhancing training and increasing professional development opportunities, increasing early intervention and early childhood special education support, implementing the suspension expulsion prevention program advisory committee, exploring alternative pathways to credentials, increasing infant and toddler specialists across the state, and expanding the employment-related daycare eligibility. So just with pediatric care, and I'll really kind of just highlight one or two of these for each of these, because I know folks are getting tired. With objective 11, OHA worked with coordinated care organizations or CCOs, including a Medicaid project by Advanced Health CCO, which is really aimed at increasing trained clinicians in Coos and Curry counties to enhance dental utilization and kindergarten readiness, with social emotional supports. A lot of stuff here as well. The ODE partnered with the Oregon Infant Mental Health Association to provide free or low-cost professional development on the infant early childhood mental health topics that focus on early intervention for home visitors. And also noting that the council also submitted a letter to the legislature, same one that I mentioned earlier, in support of additional funding for EIECSE programs, early literacy and literacy. Slide period. With objective 13, EIECSE services, ODE revised and updated the universal referral form with the Oregon Pediatric Improvement Partnership, or OPIP, in spring of this year to support the consistent referrals of early intervention and early childhood special education by pediatricians throughout the state. DELC has also been collaborating with ORINHA to implement the SEP Advisory Committee with objective 14. Just highlighting some of the work that ODHS has done with the ODHS refugee program, overseeing the Oregon Refugee Children's Assistance Services, different work than what we mentioned earlier. In June, this program announced an RFP to evaluate proposals, really aimed at expanding support for individuals from birth to 18 years old. And this expansion will also help connect families with early learning programs and offer assistance to early learning staff. A lot of DELC info here as well. Really want to note that this year DELC expanded Healthy Families Oregon to, I think the last county was Lincoln. I might be wrong, but that program is now officially available statewide. You can go to the next slide. This is where a lot of the bulk of the progress is. With the early childhood workforce, objective 15. ODE is continuing to really progress in offering alternative pathways to credentials without requiring those additional higher education for qualified candidates. DELC is working with the Oregon Center for Career Development to implement a work plan and recommendations from the National Workforce Registry Alliance study. DELC is engaging with partners like the hubs and CCRNRs and other community-based organizations to also support workforce and professional development. And then with objective 16 transitions into the K through 12 realm. ODE launching Register for Kindergarten Today, the campaign to really help raise awareness for families and start connecting early with the schools that their child is assigned to in their area. And also just want to note DELC and ODE launching the early literacy success initiative with the passing of House Bill 3198 to really coordinate some of those early literacy initiatives between K through 12 and early learning.
Getting to the tail end of our data for the presentation today. So this is data from our Department of Education related to enrollment in early intervention and early childhood special education. And you can see after a decent dip around COVID pandemic times, we are now approaching very, very close to pre-pandemic pre-pandemic levels of enrollment in these services. And just as a quick data note, you might see sort of different data sources for enrollment in EIECSE, depending on when during the year it was published. And this is data from the end of the year, end of the academic year, so August 1st. It's about as many folks who will be enrolled during the academic year as possible. That's when we get the data. If you happen to see other sources of data that might be from December child counts, which is earlier in the year, the numbers might be lower. So if you happen to see different levels that go, wait a second, I thought Lizzie showed me something else. That might be the reason behind that. And then I wanted to, I can't see who is on the call from ODE.
I think Kara's on here.
Kara's there?
I'm here, yeah.
Hi, Kara.
Fantastic. Would you like to provide any additional context about this data point?
No, I just really appreciate your context, Lizzie. So we talked a lot about what numbers we should put here. Different numbers are used for different purposes, and that can sometimes feel really confusing to folks. But we have a federally mandated child count that happens in December for special education, and that's not a very good representation of the actual numbers of children in the program. And so what you have here is the actual child count as of August 1st in the program. Other times you will see for funding purposes, we use something called a rolling average as of April 1st. So it's basically March 30th of the previous year to April 1st of this year, and we kind of roll it to give us a more accurate kind of like median number of students that we serve. But we chose to present you with this information because at our highest points, which is August of each year, these are the numbers of children who are in early intervention and early childhood special education. And it's usually spreads out to be about 1/3 in early intervention and about 2/3 in early childhood special education.
And Kara, hi, this is Sue.
Hi,
So
Sue.
I think a question that this graph begs is how many children are not being served who would be eligible for services?
Well, I think that's a hard question to answer in special education because we are required to serve every child who is found eligible for early intervention and early childhood special education. So we don't have a waiting list. What that would depend on is our child find efforts. Like, are we finding these kids? Are we referring them? That's one of the reasons that we worked on that universal referral form with pediatricians to make it as easy as possible for pediatricians to refer and also for them to get some information back on how that referral went. We also, of course, receive a lot of our referrals from Head Start and Preschool Promise and other preschool and childcare programming after children start their care in those settings. We make available screening options for families and care providers called the ASQ and the ASQSE. It's available online electronically, and they can use that, and that can help them determine if maybe a referral is called for in their circumstance. So we're certainly trying, but I think that really that it just depends on finding those kids and making sure that we're referring them as early. One of the issues we have a lot in early childhood special education is people kind of waiting it out, like, well, we'll wait and see. Maybe it isn't anything. And so we're really encouraging folks to get kids in as early as possible if you at all suspect that there's an issue.
So the story behind this data, that's what I'm trying to grasp is I'm wondering, and I'm assuming that the number of kids served went down during COVID just because everything shut down and these children became less involved in the system, had less access. And now you've stepped up services. I mean, what is the story here? Are you staffing up? Are you doing a better job of identifying them through these referrals? Why is this number changing? And how good is this? Is this good news? I don't understand the numbers very well, but I'm not in your business, so tell me the story.
So this would be a reflection of all of the things that you mentioned. I mean, I think that the additional ESSER funding was really helpful and doing what it was meant to do, which was providing additional staff in our early intervention and early childhood special education programs to get those referrals through quickly. But this is really a lift, as I was talking about Child Find, that takes everyone. This is a community effort to find kids and get them referred and get them where they need to be. So I think this is a reflection of that. I think there's also a question in your question around what concerns do we have for children who experienced that COVID era? And what kinds of referrals are we getting as far as developmental delay that may be possibly attributed to some of the experience or lack of experience during COVID times when families were in shutdown and that there wasn't a lot of opportunity for socialization. And so we are working through some of that. But if you look at the numbers between 2019 and 2024, you can see that we're back up to where we're supposed to be. We would anticipate that as numbers grow, and I think especially as preschool placements grow, one of the things that we've been trying to do is to really drive home the importance of when we think about increasing the size of our preschools. So when Preschool Promise expands or when Head Start expands, we can also anticipate that early intervention and early childhood special education will need to expand as well, that we will get more referrals just because we're seeing more children at an earlier age, and that will continue to happen. So we have to kind of like look at the programming in partnership and just really think about both of those things expanding at the whole time. But I do know that right now we have a lot of preschool teachers and childcare providers who are really concerned about behaviors in the classroom. And we are also seeing a lot of referrals for children who have behavior concerns and trying to parse out if where the core of the behavior concern. So where is that stemming from? Is that truly from some kind of a developmental delay? Is it due to some other reason? Trying to parse that out. But I know there's a lot of community call for and need for those services right now.
Thanks.
And this story is both good and not so good, right? It's great that if we can get more referrals, get more eyes on kids early, it's great. But we don't have the workforce to actually provide the services. We risk diluting the services as we increase the enrollment. So
absolutely, especially if our funding doesn't grow alongside the need. We do risk diluting. And the workforce, I appreciate that you brought that up, Peter. I think that's it's a really big concern for us as we receive more referrals, especially in our larger communities. We're really challenged to keep up with those and meet our federally required timelines for following up and ensuring that children have their evaluations and eligibility findings within the necessary time frame.
Can I ask about that workforce issue? Is it that you're not finding people qualified to do the work in the communities that are in most need? Or is it an issue around the level of compensation and support folks in the space that people are leaving the field or going?
I think for early childhood special education, it's definitely around just finding enough qualified folks to fill the positions. And now we have programs now that ESSER is finished. Now we're done with all of that kind of like emergency funding that was infused into the program. We have programs that are really experiencing kind of that funding cliff of like, whoa, now we don't have that funding anymore. And so our programs are actually right now making cuts to staffing when they really should be increasing their staffing numbers. So that's concerning. And the other thing is that we have an incredible shortage of specialists. So we just lifted up a speech language pathology so folks can apply to basically get some assistance with their tuition for going through the speech language pathology programs, because we have such a shortage in this state. And that's especially felt in our smaller communities that have a really hard time retaining those specialists who are looking for, of course, full-time employment in their profession, and often cannot find that in the smaller communities. And so they often move to the larger ones.
I think the other part of that with the specialty care is the compensation in private practice for, let's say, speech and language pathology is considerably greater than it is in the public sector, working for EI or ECSE.
Yes, and I'd say the same thing is probably true for those who are working in in the other specialty areas as well.
Also, Kara, I think it's been my understanding that some of the issues we experience for people serving younger children on compensation are also true within our specialized disciplines that are supporting Part C and Part B. Right, there's no premium paid for helping the birth provider population here. Okay, and if any, there's a lesser pay rate.
Right.
Okay, that's so great. Let's move on to something that is demoralizing. Okay.
So the last data point that we're going to talk about is from my own Department of Early Learning and Care. And this is a sort of newer analysis. So you're kind of getting like the first look at this. A newer analysis done by the Oregon Child Care Research Partnership at OSU. And for this data, we are looking at the employment-related daycare, and we're looking at the amount of time that a child spends placed consistently with one provider. So we know that consistency and continuity of care is important, so that families and children can build relationships and attachments with the caregivers in their life. And what we can see is in the 24-month interval of 2018 to 2019, the median length of time that the child was spending with the same ERDC provider was 6 months. And then during the 24-month analysis period of 2020 to 2021, that increased to 8 months. And you might think, why are we looking at 2-year intervals? What does that mean? And with this kind of analysis, it's important for us to really, whenever families start in the year, we want to give them a chance to be included in this analysis. So if we were looking just at 2018, there might be a family that becomes eligible for ERDC in November and then gets placed in December. And if we were only looking at 1 year, we would have no sense of how long they stay in the program. So that's why these 2-year intervals are really helpful in understanding no matter when families are starting, they have a better chance of being included in our analysis so that we have a sense of how long they're staying with one provider. Now, this is different from being an active participant in ERDC, period. This is really focusing in on the continuity of care, the continuity of experiences children within employment-related daycare are experiencing. And a few behind the scenes things, this increase happened regardless of the kind of provider participating in ERDC. So there are home-based providers, there are centers, there are license exempt family. Everyone saw this increase across those intervals. But there are some folks, some providers that on average have longer spells. So everyone increased by 2 months. But folks, children in license exempt relative care have the longest spells. We're talking about 11 months. They would stay consistently under the care of the provider, which in my mind makes sense. It's relative care. And then certified family has the second longest, which includes 8 months. which is 8 months in 2020 and 2021. So some new information, and it's also my first time trying to like explain this in a way that I hope makes sense. So please let me know if you have questions about that. And then also, Gwen, if there's any additional context as Dell person, I know ERDC is not your like main focus, but if there's any other context that you'd like to add.
I don't know. I mean, I was curious too when I saw that 8 months, and I was wondering if it also had to do with some of the rule changes that we made for that extended eligibility and everything, and that's just kind of my curiosity on that, but I don't know. I didn't take it.
I'm usually wondering why. The program wasn't at Delk yet, so I'm a little confused why this is the one we selected to show.
Really good point. But that's a really good point. This is a piece of data that has been on our radar for Raise Up Oregon data from before.
Yeah.
So it was something. That's a good point.
I know David's not.
I thought it was something to celebrate.
The bill had passed it. No, the program changes.
That is a good point.
Just like,
Sorry about that. But yes,
Not doing it here is always good. Right.
Does encompass the 12-month eligibility guarantee piece, so that's part of it as well.
Yeah, that would be my question.
But that didn't take effect
What's the
until
story
July
behind it? Is
It
it?
didn't take effect until July
No, because
23.
it was part of 3073, which didn't pass until 2021. It just took effect July 1.
Gotcha.
So I don't know what drove that, but it's none of the changes that have
That
been
we
made to the
made.
program.
Yeah, so the why would be interesting.
Yeah, yeah.
Oh, I would be interesting, yeah.
Yeah.
But that is part of ERDC's focus is with the extended eligibility, the ability for folks to stay in the program and to be consistently cared for. That's important. So it's related, but not. And maybe we can think that.
Why I keep asking the why is because I put my advocacy hat on. I go in front of legislators all the time on any variety of issues, and the why really matters a lot. And what is this data telling us? And for me as an ELC member, that's, I don't know, what is this data telling us? And I think if we're gonna go for more funding, if we want to make tweaks to any of the rules or any policies, that we juxtapose that data with how much money we're spending and what the outcomes were that we were shooting for and what this data is actually telling us.
So the fact that it's good, it's good.
Right.
But the fact
Really
that,
great.
but it's not good, it's not good enough because we can't tie it to an action.
Right.
Then we can't.
Yeah, they can.
That could be sort of random. It's like,
Well,
oh, no, that's not.
Yeah, to this point, it's like, I'm just noticing like how much explanation each of these data points are like. Are requiring for us to like really understand and be able to talk about it ourselves. And so that's a challenge that is in front of you of how do you give it to us in a digestible form that's meaningful and powerful and impactful.
Right, and then how do we convey it to?
Yeah.
Legislators.
Yeah.
There's a goal for the year.
The way I'm hearing this is within the constraints that Lindsay shared with you about causality. Okay, the piece on the table is whatever data is included, there needs to be basically an explanation. What do we believe? Okay, what might be the part was happening that allowed a positive change. That's how I'm hearing this conversation.
Okay.
Because the documents in the end aren't gonna have a whole crew of neighbors up all the time. So if the data points are gonna be good, then you have to work to really basically give a reasonable explanation of what was happening contextually. Basically, that we think this is a contributor to the advancement to the positive data.
Sorry, I'm like curious about the causality, like that discussion around that, because I understand that from a researcher's point of view. They want the data to have integrity. They want to make sure that, you know, like we're not making claims that aren't really there, right? And yes, I want integrity. I don't know, this is public. Yes, I want this to have integrity, and I think we need to lay claim where we can lay claim, right? We want to advocate, we want to, I'm not saying we should like, fudge the numbers or anything like that. I'm just saying.
They don't matter, Susan.
I'm just saying, when we say like an outcome has happened or something is moving in the data, we do want to say, we think these things mattered and supported that to be better. And so I think it's okay for us to do that.
And contextualizing why each of these were selected as the thing to represent a variety of strategies, I think is important to then get at that, the what drove it.
Exactly. Okay, let's wrap up this part of our discussion. Gabby, do you want to do the last slide?
Yeah, I think there's two more after this, but yes, almost done. Again, kind of just highlighting, some of the activities and outcomes that you all did in regards to this goal, really with workforce and social emotional health. With workforce, right, the council did have a, council meeting specific to, workforce initiatives, and we've heard from workforce boards. So again, the council is continuing collaboration and relationship building, and really just continuing to champion some of the work to improve the workforce. Social emotional health. And also note that the council invited partners and agencies to really just talk about social emotional health initiatives. We heard about the suspension expulsion prevention program in April. Subin also serves as a council liaison on the second advisory committee, so he's keeping the work going there. Peg testified on behalf of the council at OHA Scoring and Metrics Committee in support of including the social emotional metric in the 2025 CCO metric set. And again, just tying back into what I previously shared around the council submitting a letter of support to the legislature. Again, back in February, you all provided a letter to support an increase in funding for EIECSC services, early literacy, and employment related daycare. In the outcomes, you'll just see, right, the 22 million in funding that we help support for was secured for OEE. There was also 10 million in funding for early literacy. Of that 10 million, 8 million was for communities and 2 million was specifically for the 9 federally recognized tribes in Oregon. The system level social emotional metric was adopted. And then just, yeah, that's good kind of highlight. This one we can keep really brief, just wanted to highlight just some of the work that y'all do in regards to rulemaking. Again, this doesn't account for all of the rule sets that you all voted on, but really just wanted to highlight some of the programs and just the outcomes in that. Really just highlighting the employment related daycare waitlist and the rule change that made enrollment for eligibility for enrollment in Baby Promise basically an exemption to the ERDC waitlist, which is great. Micro Center pilot, just really creating the framework for that pilot program. Baby Promise, again, also just outlining the purpose of the program, eligibility for families, and the CCRNR's role in administering the program. Child care resources and referrals match. That rule change just updated the definition of core services and provided just clarity on the 10% match for CCRNRs to create more funding sustainability for those local entities. If there's one more, I'm just bringing this home, just highlighting some of the work that's happened since last month here at the top. The council was requested by Governor Kotek to identify some priorities for her early childhood agenda in the upcoming year. Last month, you all heard from agency directors, and with that, we submitted a letter to the governor to just indicate some of our priorities and just encouraging education, early learning, childcare, behavioral health, housing, state, local, cross-sector partnerships. The chart that I think you all have seen is in your packet as well, that really just calls out more specifics to those. In addition, I know you've all been engaging with legislators, but wanted to highlight just engaging with Brett Reynolds to advocate for policies that support well-being and the development of young children as related to Momnibus, and then really just continuing to foster relationships with policymakers. Yeah. Good questions.
I think we questions.
Well, I think we're all ready for a break.
Yes.
Yeah, so I really want to thank.
Oh, absolutely.
And our RUO members who are here. Thank you for pulling this together and engaging us in conversations that I know you all have monthly, trying to help figure out how to support the council and help us support you in your important work. So we really, really appreciate you partners.
Thank you, Sue, and thank you to everyone. So we're gonna take a break until 3:15. I think I'm going to see if we might be able to get the heat turned down in the room. Is it feeling a little warm in here, or are we all okay? Was wondering if that feels good. It feels good. Okay, we won't get the heat turned down. So go
There's still
outside.
drinks and cookies out in that room over there, so if folks wanna snack. Cookies.
Sugar.
Sugar.
Yes, sugar and water. Okay.
Yeah.
Okay.
I'm gonna take a walk.
I'll send you.
Yeah, and we know how it works.
I just tracked my ballot down.
You wanna plug in?
Apparently the box that I submitted my ballot in, I took, I did on fire.
Wait, Councilman?
Yeah,
Wait,
Portland.
Councilman, you're.
Yeah, that was my.
Oh my God.
The one I submitted in.
Apparently